Friends, we have reached the final 6 nighttime symptoms of diabetes. These are signs that are especially often overlooked. People blame them on the heart acting up, overeating, nerves, or just stress. But in reality, they are serious indicators that glucose is interfering with the work of your heart, brain, breathing, and sleep. I want you to know these symptoms clearly and be able to protect yourself in time. Symptom 13, nighttime tachycardia and hot flashes. Why it occurs: when glucose levels fluctuate sharply, the autonomic nervous system is activated. The heart starts beating faster with sensations of palpitations or hot flashes. Statistics: American Diabetes Association 2021. Up to 15 to 20% of diabetics regularly report nighttime tachycardia. Danger: nighttime arrhythmias increase the risk of stroke and sudden death during sleep. How to distinguish? In panic attacks, tachycardia is usually combined with anxiety. With diabetes, it occurs without obvious reason during the night, often with elevated glucose. What to do? Measure glucose when tachycardia occurs. Avoid sweet, carbohydrate-heavy dinners. Discuss an ECG and heart evaluation with your doctor. Symptom 14, frequent nighttime urination in men. Why it occurs? In diabetes, the bladder fills more quickly due to osmotic diuresis. In men over 50, prostate enlargement may also play a role. Statistics: Mayo Clinic 2019. 30% of men with diabetes complain of frequent nighttime urination. Danger: combination of hyperglycemia and prostate enlargement increases risk of urinary tract infections. How to distinguish? With prostate issues, urination is frequent both day and night. With diabetes, mainly nighttime, combined with thirst and dry mouth. What to do? Check glucose. See a urologist if needed. Avoid evening alcohol and sweet drinks. Symptom 15, snoring and sleep apnea. Why it occurs? Excess weight and diabetes increase obstruction of the upper airways. A person may stop breathing for 10 to 30 seconds, the brain briefly awakens, and loud snoring occurs. Statistics: BMJ 2018. 40% of men with obesity and diabetes have sleep apnea. Danger: risk of heart attack and stroke increases 2 to 3 times. Sleep becomes fragmented. Glucose is harder to control. How to distinguish? If your partner notices pauses in breathing with loud snoring, this is sleep apnea. With simple snoring, there are no breathing pauses. What to do? Weight loss, sleep study, polysomnography, CPAP therapy if prescribed by a doctor. Symptom 16, nighttime heartburn and reflux. Why it occurs? Late dinners with carbohydrates and fatty foods provoke acid reflux. In diabetes, gastrointestinal motility is often impaired, worsening the reflux. Statistics: Harvard Health 2019. 20-25% of diabetics report nighttime heartburn. Danger: chronic reflux damages the esophagus and increases the risk of esophageal cancer. How to distinguish? Occasional heartburn after overeating is rare. In diabetes, it happens repeatedly, especially at night. What to do? Finish dinner 3 to 4 hours before bed. Avoid sweets. Sleep with head slightly elevated. See a gastroenterologist if frequent. Symptom 17, restless legs syndrome. Why it occurs? Diabetic neuropathy and glucose fluctuations irritate nerves. A person feels twitching, tingling, or an urge to move the legs, especially before sleep. Statistics: Mayo Clinic 2017. 25% of diabetics have restless leg syndrome. Danger: chronic sleep deprivation, worsening fatigue, reduced quality of life. How to distinguish? With stress, leg twitching may occur during the day. In diabetes, mainly at night, interfering with sleep. What to do? Check glucose. Avoid caffeine and alcohol in the evening. Do light stretching exercises for the legs before bedtime. Symptom 18, nightmares. Why it occurs? Nocturnal drops in glucose, hypoglycemia, trigger brain activity and vivid, frightening dreams. Statistics: Cleveland Clinic 2020. 15% of patients on insulin report frequent nightmares linked to hypoglycemia. Danger: hidden nighttime hypoglycemia can go unnoticed and increases the risk of coma. How to distinguish? If nightmares occur several times a week and are accompanied by sweating, trembling, or morning weakness, glucose is the likely cause. What to do? Measure glucose around 3 a.m. Discuss insulin doses with your doctor. Avoid late fast carbohydrate snacks. Conclusion of the trilogy. We have now covered all 18 nighttime symptoms of diabetes, from frequent bathroom trips and thirst to neuropathy, restless legs, reflux, and nightmares. If you notice at least 3 or 4 of these signs, This is a serious reason to check your glucose and HbA1c. I guarantee if you pay attention to nighttime signals, adjust your diet, and consult your doctor in time, your sleep will become deeper and your glucose levels more stable within the next weeks. Now my question to you. Which of these symptoms do you most often notice? Tachycardia, heartburn, snoring, or nightmares?